As with almost all procedures, there are risks inherent to the use of the sling. It is possible that after you have the procedure, you won't be able to void completely or even at all for the first few days. Many patients are sent home from the outpatient center with a drain in the bladder in order to prevent this problem. I can tell you that after doing 1,300 of these procedures, I have never had a problem go more than 10 days without being able to void. In other words, this is almost always a temporary problem. The other risks that are inherent to the use of the sling are the risks associated with surgery, namely anesthesia, the risks of bleeding, the risks of injury to surrounding organs. There is also a risk that is very publicized today, and probably over-publicized, concerning the risk that is thought to be inherent to the use of using synthetic material in the vagina. There is an FDA warning, and I always refer patients to the FDA website regarding the use of synthetic material in pelvic reconstructive type surgery. Now, these risks are thought to be as high as 4 to 14%, but I can tell you again, in my experience, the risks are far lower, especially in this procedure, because the surface area of the sling that's exposed to your tissue is so small. But those risks can be ingrowth of the sling material into surrounding organs. It can erode into the vagina. Most of the time that happens, we can treat that in the office, but it is possible, and it has been reported, that more surgery would be required to remove the sling material if it does in fact grow where it's not supposed to. Again, I can tell you, after doing 1,300 of these procedures or more, I have never once taken a patient back to surgery to remove a sling that I have previously placed.